Welcome back to the NetG podcast. This is Aurora, and we're going to cover next the Healing and Wellness Council. So, the idea for this council is basically to have beings who have experience and their background in healing, wellness, metaphysics, even those who may have a background in the more kind of 3D traditional medical system. And basically, it is for the kind of oversight of the transition of the current medical system into more of a healing and wellness system. As we know, the current system, it has its pros, right? We do have some positives in the current medical system, right? That I think will still be around throughout the transition. And then there's a lot of parts of it that are going to need to be dissolved. Because currently, overall, if we just look at the medical system as a whole, it doesn't promote healing and wellness. A lot of it is, it's for profit. So there's a lot of issues with that. It's not accessible to everybody. And also just that it is very disconnected from understanding the body. And how energy and emotion plays a part in the health of the body, right? So there's a lot that's kind of missing from this sector. So this council is going to be for basically educating not only healers and practitioners, but also humanity themselves on the overall self-healing and ways to keep our physical vessel and emotional vessel and mental vessels, right? Because we have a physical, emotional, and mental bodies. How to keep those in synergy, how to keep those healthy and well. So the roles and responsibilities of this council is made up of energy masters who are responsible for educating humanity and, like I said, also practitioners on maintaining their physical, emotional, and mental health through the transition. So this council will ensure that all of humanity is educated on how to self-heal, how to manage their energy systems, how to dissolve the ego mind, which is going to become a very important part of mental wellness, how to transform lower thoughts, fears, right? How to heal collective trauma, and also guidance on going through the crystalline process. And the crystalline process is really just that our bodies are becoming more light-based, right? So it's going to change the way that we interact with the body, the way we treat the body, all of that. This council also will be sharing information with humanity and practitioners on organic healing tools and self-healing techniques. They will also be the leaders of healing and helping to assist all on their inner journey, as well as sharing information on various alternative healing modalities, etc. This council will ensure the oversight of all healing businesses, centers, etc. And this council will also serve as its own network. By assisting humanity through education, services, and goods. So the point here is to make sure that all forms of healing, all modalities of healing are shared, right? Because a lot of times, again, especially in the current traditional system, there is a very limited range of intervention, right? For when we have issues physically, emotionally, or mentally. There's a very limited perspective and limited modalities on how to correct that, how to heal that, and interventions, right? But in truth, there is a wide variety of healing modalities. There is a wide variety of techniques, tools, anything from self-healing, right? Which is going to go into a lot of understanding the tools and techniques for maintaining your own health and wellness. And then there's a million different types of modalities. There's metaphysical modalities. There is energetic healing modalities. There is holistic healing modalities, natural healing modalities. So this is to open this up so that all of humanity has access to the same information, and to ensure that healing centers, practitioners, healing goods and services are available to all in a form that is affordable and accessible to everybody. So that is going to be a big part of this council's role. And one of the first decrees that we came up with for this council was the Universal Self-Healing Decree. And this decree says that all prior forms of medicine and healing, including the current medical system, hospitals, personnel, medical institutions, agencies, pharmaceutical companies, etc., are now dissolved. They will need to transition into 5D healing industries. The United States will immediately implement training for all current medical and healing personnel to be trained on some of these alternative healing modalities, such as energy healing, metaphysics, herbalism, self-healing, self-empowerment, and all other organic healing modalities. Healing centers will also be set up within 90 days. Again, this is, we preface this by saying this is when the transition is really underway and we are able to institute these decrees immediately, right? So healing centers should be set up within 90 days of the official transition, and training provided for all practitioners, all healers. All healing information also will be open source and will be provided both on a local level, state level, and federal level by the councils. All beings with healing gifts and experience will also be called as mentors and guides for the collective. And all healers who run their own healing businesses or provide healing services and goods will also be shared amongst local and state networks. So we want to, again, have a variety of healing outlets, healing modalities, and healing practitioners that are able to be shared as a network on a local and state level, so that all beings who are looking for assistance with physical, emotional, mental healing have access to these providers and can kind of go with their own guidance of which modality they would like to try, right? The second decree is the Healing Systems Transition Decree. All 3D healing systems and institutions will immediately transition into 5D healing systems and modalities. This includes hospitals, medical facilities, therapy, counseling, and treatment centers that all deal with physical, emotional, or mental or spiritual healing. All medical or treatment personnel will undergo training on the 5D tools and techniques, metaphysics, alternative healing modalities, as well as the system transition. All current systems, institutions, or modalities that cause more harm than healing and do not address the root causes will be dissolved if they cannot transition. The public will also be educated on 5D healing systems, technology, and modalities for their own self-healing and holistic living. So the point is here is that with a lot of these industries, we know that there are certain aspects of each industry that will likely not be able to transition, meaning there's really no way to transition that aspect from 3D to 5D. And we know that this is part of the ascension process. It's not to just, I think during the transition of all these industries, it's not to just blanket say all of this needs to go. In some aspects that will be necessary, right? As I've mentioned with some of the previous councils and those industries, there will need to be a complete overhaul, a completely new system built. Within some industries, there will be aspects of it that can transition, right? They can kind of change the way that they're operating from a 3D standpoint to more of a 5D standpoint. Some of these aspects, though, won't be able to transition. For instance, pharmaceuticals. I think that's a hard one to transition. I just don't see any way that it would be able to be in line with 5D. A, because it's profit-based, solely profit-based, and B, because we're dealing with a lot of inorganic substances being put into the body when we know that there are many, many, many more options in terms of healing that are much more beneficial, way less harmful than pharmaceuticals, right? But there are aspects of the industry that possibly could transition, right? We could see things like hospitals, care centers, all of that kind of stuff transition. There's going to be new technology coming in as well in terms of 5D healing. That's going to completely revolutionize the industry. Having people having access to not only education, but different types of services and products and things like that that can they can utilize on a day-to-day basis will limit also the amount of healing that people will need to be constantly seeking, right? Instead of constantly going to doctors, a lot of people will be able to manage their physical, emotional, and mental health on their own, right? Unless they do need assistance in a particular area. So physical healing wise, I think there's already so many amazing alternative educations, goods, and services for that. Emotional healing, right, and mental healing in terms of things like therapy and counseling, mental health institutions, all of those are going to have to undergo a big overhaul because currently there's not a lot of availability, I think, for assisting people in these areas. I think we have a lot of stigma and misunderstanding of certain things. Like there's a lot of diagnoses that go around, a lot of labels and diagnoses that are really not beneficial to the being, right? Especially when we talk about mental health. There's a lot of labels. And a lot of it is a lack of understanding of the relationship between the mental, emotional, and physical body. There's a total lack of understanding of how we share consciousness. There's a lack of understanding about the ego mind and the way that it works. So those are going to be a kind of complete overhaul. So for many of you, during the transition, if you feel passionate or you have experience or you are guided to kind of be one of the front runners of these transitions, then you might be called to, kind of begin learning different modalities for these types of healings, right? As I said, physical, emotional, or mental. And even spiritual healing, right? A lot of us who work in the spiritual healing realm, there's going to need to be a lot more of those services offered as well. So during the transition, many of you might feel guided to be a part of that healing and wellness transition. There is so much, that is available to us, even just from an herbalism perspective, right? And understanding all of the herbs and the vitamins and the minerals that we naturally have available to us for healing. I think physically, I do have a feeling that things like massage therapy and kind of energy work are going to become really essential as well. A lot of just what causes ailments is things that get stuck in the body. And as we know currently, right, like things like massage therapy or energy therapy, right, it's usually very expensive. It's not accessible. It's not like someone could just go and get those services regularly and affordably. So I think that's a big industry as well, and a big part of the transition. Is to actually help move energy out of the body. So there's a lot of opportunity for healers and those in the wellness industry to be a part of this transition. So for those that, are guided to this and feel that they would be a part of it, it's definitely a great time to start feeling into what your skills are, feeling into what your gifts are. And also, if let's say you have no experience in this realm, but you feel very passionate about it and you feel very called to it, it's a great time to start learning about different modalities, absorbing information. And also remember that a lot of you might have been healers in other lives and not just this one. So even if that's not something you've practiced in this particular life, but you have an understanding, kind of this innate knowing and gifts around this area, everyone can start downloading those gifts and skills as well. So if that is an area you're interested in, this is going to be a huge part of the transition, and probably one of the first councils and the first industries that goes through a big shift and change. I would say, along with the business and finance industry, that's going to be a huge transitional one. Healing and wellness is also going to be a huge transitional one, because there is so many beings within humanity that are in dire need of healing on all levels. And so this is a great time to really feel into that. And many of you might be a part of that council. So that is the Healing and Wellness Council. And I will be back soon with our next transitionary council, which will deal with technology.